Hi guys. So this video is going to be about what is lupus. And uh, the reason why I'm making this video is because a few semesters ago I was talking to a few classmates in regards to lupus, and somebody asked, they said, "Is lupus a sexually transmitted disease?" So once he asked me that, I realized that not many people really know what lupus is. So, um, I can't blame him for not knowing what it is because, for one, the media doesn't bring it out as much. A lot of people that have lupus don't like to talk about the fact that they have lupus and share and educate people that don't know about lupus. I myself have lupus, and I was diagnosed in 2013. And I will make a video about my experience with lupus and some of the drugs that I've taken that have not worked, the diagnosing process, and some of my symptoms and stuff like that in another video. Um, but I would like to keep this video more of a educational video to help people that um, either have lupus, have been recently diagnosed with lupus, or somebody that has a friend or family member who has lupus and don't know how to help them. Um, and I guess a couple other reasons why too is because um, I'm making this video is because lupus to some degree is like an invisible disease, so to say, because most of us that have lupus look perfectly healthy from the outside. Like if you saw me walking out in the street, you couldn't guess that I had an autoimmune disease, or that I have a chronic inflammatory disease, or that I have kidney failure, or that I have other issues. You can't really tell from just looking at me. And to some point, that could be a problem because um, in the society that we live now, a lot of people who have invisible diseases, not just lupus, but other invisible diseases like mental diseases, OCDs, anxiety disorders, schizophrenia. There's a variety of invisible diseases that people have to fight every day that you can't just tell by just looking at them. And um, yeah, how many times have I seen a young person um, park in a handicap spot that looks perfectly healthy, and I see like an older person who gets off of the other slot in a handicap and then starts telling them stuff because they look young. Like, um, I saw once there was an old man who saw a younger girl and said, "You look like you're 22. You don't look like you're sick. You should leave that spot for a real person that has a disability." And at that point, I was upset because this person was mistreating this other person and judging this person. Granted, this person was an older man and probably didn't know about um, invisible diseases, or about this fight that this person might be going through that you can't see through the outside. So it's a lot of stuff. So if you ever see somebody who looks healthy from the outside and is parking in a handicap, don't judge that person because you don't know what that person might be going through. It's it's the silent fight that somebody might be going through. Now, moving on to um, the educational part of this video, lupus is a chronic inflammatory disease. It's basically your body um, fights, or like it attacks your tissue and your organs. Now, it can be from, like, your body can attack anything from your joints, your skin, your kidneys, your heart, your lungs, um, basically anything really. Um, and because your body is constantly attacking itself, either if it's your joints or your skin or anything like that, it's like you're constantly have like the flu. It, I mean, it's that's like the thing that I can compare it to when I try to explain it to somebody that may not know what the disease is like. It's like you have the flu like 24/7 almost. You know, when you have the flu, your body kind of just aches. You're so tired, you don't feel like doing anything. Um, that's one of the symptoms. You have fatigue, and you may even have a fever because your body is on that constant inflammatory um, phase. So it can be very painful for some people that have um, joint pain or muscle stiffness. Um, let's see, um, like Raynaud's phenomenon. Raynaud's phenomenon is um, when your fingers change colors due to um, cold temperatures or stress. They change from white to blue, and that can be very painful. The headaches, the memory loss that you might go through. I suffer sometimes from memory loss, and sometimes it's very hard to explain to somebody that, yes, you did tell me that, but I don't remember, or um, can you please explain it to me again? Um, if you do have a family member who has lupus, try to be understanding of that person because it's very exhausting um, to have to tell you that you're in constant that I am or that person is in constant pain. And to some degree, people who have lupus, they kind of learn to fight that fight by themselves because they feel like they make it tired of having to tell you, oh, I have so much pain right now, or I feel so tired, or I can't get up this morning because my joints are so stiff, or my body is so stiff, things like that. It makes it really hard, or maybe even going to the zoo and seeing all the animals is kind of hard just because if you're exposed to the sun, you have photosensitivity, you might start up a flare, you might start to have symptoms, you might break out in a rash like I do when I get exposed to the sun. Um, and it's it's very it's very exhausting to have to constantly have to explain to people why you can't do certain things sometimes. Um, Even though the cause of the disease has not been actually pinpointed, they believe it's genetics, it's environmental factors. Sometimes it can be induced by medications, but the good thing about lupus that is induced by medications is that once you're done taking that medication, your symptoms go away. But when you have lupus, there is no cure um, as of now. As of January 7th of 2016, there is no cure for lupus. Um, you can only um, go into remission, like um, some of the medications that they may give you. They may be taking anti-malarial drugs, which is Plaquenil or hydrochloroquine, corticosteroid medications or immunosuppressant medications, maybe even over-the-counter non-steroidal anti-inflammatory drugs to help you with your symptoms, but there isn't really a cure um, to help you. Some people even go through chemotherapy to try and um, help them with the disease. And that itself can be very hard. And to most of the medications, the actual side effects to the medication can be worse than the actual disease. But you kind of have to outweigh your pros and cons. And I mean, it's a very exhausting disease, and it's very sad because, like I mentioned before, to some point you feel like you're alone because sometimes people don't really understand what you might be going through. Now, lupus is very hard to diagnose. Not every lupus case is the same. And I think that's why it makes it so hard to diagnose because there isn't like a hard copy that tells you, okay, lupus, if you have lupus, you have fatigue, you have fever, you have headaches, you have memory loss, joint pain, stiffness, um, and you have a CBC or a complete blood count of this, or a UA, you don't have this stuff, protein or bilirubin or whatever. There isn't really a test for lupus. There is tests that are done to um, minimize the possibilities that you may have other diseases. For example, they do a complete blood count, an erythrocyte sedimentation rate, which is they test the rate of the blood cells settling down at the bottom of the tube in an hour, and that can tell you a lot based on that test. A kidney and liver assessment, a urinary analysis, which is when they make you pee on a cup and they check for proteins, ketones, bilirubin, and many other stuff. Um, and the very controversial anti-nuclear antibody test. And I say controversial because a lot of people believe that if you have a positive ANA test, um, you have lupus. And that's not always the case. What an ANA test basically tells you is that there are antibodies in your body, or an elevated amount of antibodies in your body. But they have to run more tests to narrow it down. I think one of them is like a double strand DNA test and then a histone test. Um, but I mean, there's a series of other tests that they do because lupus is known as a great mimicker of diseases because it mimics so many other diseases that it's really hard to just pinpoint. I mean, the diagnosing process could be very exhausting because you have to do a series of tests for one thing, and it turns out you don't have that. So then they test you for this and they test you for that, and not only exhausting, but it could be very financially expensive because um, you have to pay $1,000 worth of just lab draws that you were done that had to get sent to Mayo Clinic to get checked and stuff like that. But I mean, if you have a family member, a friend, or if you currently have lupus, um, don't feel alone because there's many people out there that have lupus but um, don't feel very comfortable about talking about it. And I personally am very open to telling people anything about lupus because I like to educate people, which is why I'm making this video. I'd like to um, answer people's questions if they have lupus, um, and most importantly, that you don't feel alone. And if you're having symptoms of any sort, go get medical help because when you nip something in the butt faster, you can get treatment for it faster, and maybe you can um, avoid it from getting worse. That is one of the things that my doctor did tell me, that I came in early enough that I don't have organ involvement yet. And I'll talk more about that in another video. But yeah, um, I mean, if you have any comments, any questions, feel free to comment on this video or send me a message. I'll be gladly be able to help you with any questions that you may have in regards to the disease. Um, so yeah, have a good day.